Whispering Hope Australia presents a Spring Do with Replay 6, held on Saturday the 14th of November 2015, held at the Valawa Bungalow from 7:30 p.m. to midnight. For further details, please contact Philomena on 9769 0051. The Grandon Princess proudly presents New Year's Eve Dinner Dance with Replay 6, Desmond De Silva and Cloud 9, held on the 31st of December 2015 from 7 p.m. to 1 a.m. For further details, please contact Graham Blaze on 0413 338 934. Sohan Veerasinghe and Corinne Almeida present the Breakaway Ball, held on the 31st of December 2015 at the Eagles Lakeside, Athiria, Sri Lanka. For further information, please contact Sohan on +94 777 363 416. The Sri Lanka Morning Show brings you the following job opportunities in the Australian workforce: sales consultant, real estate and investment sales, construction labourers, waiting staff, chef, cook, cabinet maker, scaffolders, mechanical fitter, general labourers, crane operator, customer service assistant. If you require any further information, please email us on srilankamorningshow@gmail.com or call 1300 554 067 or 988 48 275.
Good morning. Today we have invited Dr. Sujit Senuratna, Associate Professor, Director, Cardiac CT Service, Interventional Cardiologist, Monash Heart and Monash University. Good morning and welcome to the studio, Doctor.
Good morning, Sally, and thank you very much for inviting me.
And when we talk about cardiologists and cardiac care, it's mainly about the heart. Doctor, would you be able to briefly tell us what the heart does?
Very good question. I think the easiest way to explain the heart is to think that it's a machine. Heart's got three main components. The first is the electrical system or the wiring system of the heart. And then we have the most important function of the heart, which is the engine room, or how heart pumps the blood to the rest of the body. And that includes the heart muscle and the valves. And finally, for the engine room to work, we have to have fuel coming into the heart, and therefore we have a plumbing system, in other words, coronary arteries. As I mentioned again, the three systems are the electrical system, the engine room, and the plumbing system. And then we can look at each of these components to understand the main problems of heart. So if you, as an example, if you look at the electrical system, it can be either a problem where the electricity is too slow, or the wiring system is faulty, that the electricity travels too slow. And in that kind of situation, we look at devices like pacemakers. And sometimes the electricity or the heart rhythm travels too fast. In those kind of situations, we look at drugs, or sometimes to ablate or to block the extra pathways that cause these extra electrical currents. When you look at the engine room or the heart muscle, the main issue with that is that it can function poorly, which leads into what you call heart failure. And again, if you look at the valves actually direct the blood in one direction inside the heart, and the valves can be either leaky or narrowed. And depending on that, you may have surgery or various other procedures. When you look at the plumbing system, that refers essentially to coronary arteries. And if you have blockages in coronary arteries, and that's the risk of heart attacks and so on. And for those, we may have various medications, angioplasty or stenting, or bypass surgery. I think that's a kind of a summary of various components of the heart and where things can go wrong.
So that's the explanation of the heart function and functionality of the heart. And when you look at it as a doctor and intervening with regards to heart attacks and pain in the heart, what are the symptoms that one would really look at to go and check yourself with the scan or the CT scanner that you have? What are the symptoms one would have?
Right. So we now concentrating on the plumbing system or coronary arteries. So how do these coronary arteries manifest? They can manifest in sort of a slow or what you call non-acute setting or acute setting. So acute setting means when somebody is having a heart attack, and the non-acute setting means that the patient has symptoms, they're brief, but it hasn't actually caused any damage as such. So if you look at patients who have intermittent chest pain, so chest pain is the most common presentation, and it's usually in the middle of the chest, but it can be to the left and occasionally to the right. It can be down their arms, more commonly on the left arm. It can be in the jaw, or it can be in the upper back. So there is no one particular place, but most common place is the chest. And the most alarming sign is that if somebody actually does in any form of physical exercise, and they can in a predictable way get repeated symptoms, that's the most concerning symptom. In other words, if somebody carries grocery, go up a flight of stairs, and if they get chest discomfort or arm discomfort or jaw discomfort in a very predictable way, that is coronary artery disease until proven otherwise. Some people may just notice that their exercise tolerance has dropped all of a sudden, and they can't walk the same distance that they used to walk. So that may be a sign as well. So particularly in patients with diabetes, you don't often get chest pain. It may only be shortness of breath. So I think the most important thing is, well, if you have chest discomfort or any of these other discomforts, which is happening particularly when they exercise, or if there's a sudden change in the exercise capacity, it's very important to go and see your local doctor. Now, to answer the other part of the question, which is if somebody is having a heart attack. Now, heart attack means an artery is blocked, and that means a particular area of the heart muscle is not getting blood at the time, and therefore the heart muscle in that particular area is dying, and that leads to persistent symptoms. Usually, again, it's chest pain, but again, as I mentioned, it could be arm discomfort, could be jaw, and usually they may be associated with some sweating or some nausea. And the important thing is if you got persistent symptoms, you're feeling unwell, and you should call an ambulance. And again, another important principle is that we often think that heart attacks actually produce really severe pain and we're really unwell. But that is not the case. Most of the time it is just a relatively mild discomfort, which is persistent, and you think it is gastritis. But until it is proven to be gastritis, we have to always suspect that this could be a coronary event or a cardiac event. And again, being young age doesn't always protect you. I mean, these days we see younger and younger patients. We see often 40-year-old and in fact even 30-year-old presenting with heart attacks. So age doesn't protect you entirely either. So I think important message is to be aware of these symptoms and act quickly if you have these symptoms.
And that's all for today. Until we see you again next week, have a pleasant week. Ayubowan.